Hello, I'm clinical psychologist Amanda Gordon. Weight management is a difficult issue to raise with patients, and weight management consultations often take time and require extensive counselling as you work through concepts with your patient. You may need to use techniques such as motivational interviewing, and these techniques can be challenging for GPs, especially given how time-poor many of you can be. The following series of videos features Dr. Chris Moody, a GP experienced in patient counselling, as he leads his patient Tamara through a weight management consultation. The videos focus on the communication aspect of the consultation and provide some ideas on how to better engage your patients in discussions about their weight. Throughout the videos, I'll be reviewing the key points of the consultation to help bring out some of the important counselling points that you may want to use in your own clinical practice. You're about to see video 1. Dr. Moody is going to greet a long-standing patient whom he hasn't seen for a while, and of course he notices immediately that she's put on weight and that might be an issue. So he greets her with an authentic interest in her life, listening carefully for the hooks that he can then use to bring a discussion around to important health issues. Notice his stance, that he is ensuring that the desk is not between him and his patient, but that he is able to clearly see her, engage with her with proper eye contact, and listen carefully to all that she says.
Well, Tamara, it has been a while. How are you and how's the retail world going?
Yeah, I guess it has been a while. Work's been really crazy at the moment, so I just kind of lose track of time. They've cut back on staff and they've upped my hours, so I've just been really busy.
More responsibility and longer hours. How are you managing all that?
It's been pretty intense, plus Mum hasn't been well. She wasn't taking her diabetes medication properly, so I've been looking after her.
I'm sorry to hear about that. It sounds like you've got your hands pretty full at the moment between looking after Mum and the pressures at work. That must be very stressful. What can I do for you today?
Well, I really just popped in to get a quick referral to the podiatrist. My bunion has been giving me a lot of trouble lately.
Okay, I can see here that your last visit was nearly 12 months ago when you were in with a sore throat. Are there any other health issues that we need to look at today?
Nope, I don't think so.
Did you notice how Dr. Moody let Tamara know that he really had time for her today and that he was going to listen to all that she had to say? He used good active listening skills, using his whole body language to show her that he was interested. The way he sat down and didn't have the desk between the two of them, his posture as he leaned towards her, his facial expressions, his eye contact, and ensuring that the environment wasn't distracting for him. He used open-ended questions with a focus on her, wanting to know what she had to say and avoiding judgment. He demonstrated real interest in her life in such a short time, and was yet still able to ask questions to clarify anything that he didn't understand. He avoided interruptions and had attentive silences to her. Then he was able to reflect back what he'd heard to ensure that it was all clear and summarise the major issues.
Can we just check a few things? Would it be okay if I took your blood pressure?
Really? Oh, yeah.
That's 128/77, not bad, Tamara. I also weigh all my patients regularly. It's an important part of assessing overall health. Would it be okay if we took your weight today?
Of course, you'll want to plan your consultation structure. Questions such as, are there any other health issues that we need to look at today, can be very helpful to ensure that you have found out everything that the patient has on their mind. And you need to integrate weight assessments into the consultation. Perhaps a statement like, I weigh all my patients, as it's an important part of assessing overall health. And I note that we haven't recorded your weight for a while. Could be very helpful. But let's see how Tamara responds when told that.
Yeah, but it's probably a bit up. With Mum and work, I've been a bit erratic with meals and eating on the go. Probably lots of stuff I shouldn't be doing.
Let's do that now.
This is a difficult part of a consultation for both the patient and the doctor. But notice how Dr. Moody stands to the side of Tamara while measuring. Standing in front of her may be seen as confrontational and may make her even more uncomfortable. While attaining permission at each stage of the process, Dr. Moody asks Tamara to hold the tape measure in place while he moves around to her other side. It's important that he doesn't reach both arms around her, as this can be inappropriate. And if his arms didn't reach, this too would embarrass her terribly.
All done. Let's go and sit down.